Good afternoon. My name is Ghijselings, and today I would like to present you the results of our interim analysis on a prospective single-center study, the efficacy of sacral neuromodulation therapy on patients reported with urinary symptoms and bowel symptoms related to the medical department. And these are my disclosures. So first of all, let me give you a short background on sacral neuromodulation. Sacral neuromodulation is a widely practiced therapy for a variety of refractory lower urinary tract dysfunctions, but also fecal incontinence. It is a two-stage procedure in which in the first stage a permanent electrode is placed, followed by the placement of an implantable pulse generator in case clinical success is obtained. Baseline and test phase assessment are needed to decide whether to proceed to the second phase or not. Unfortunately, physicians often tend to focus on discipline-related symptoms, thereby neglecting a bit other pelvic floor dysfunctions. However, we notice in clinical practice there is often concomitant overlap of symptoms. So our aim was to map the prevalence at baseline of urinary symptoms in patients consulting the colorectal surgery department and vice versa to map the bowel-related symptoms in patients consulting the UD or the urology department. And secondly, the efficacy of SNM on non-discipline specific patient-reported outcome measures was evaluated. So from February 2018 till March 2020, patients referred to the UD or the CRD department were enrolled. They all underwent InterStim 2 therapy of Medtronic, and patient-reported outcome measurements according to urinary or bowel symptoms were assessed at baseline and during the test phase. Therefore, we asked them if they had urinary symptoms or bowel symptoms, yes or not, and how much they were bothered by those symptoms. We also used validated questionnaires, the ICIQ and LUTS, ICIQ FLUTS for general lower urinary tract dysfunctions, and the ICIQ urinary incontinence short form questionnaire. For bowel symptoms, we used the ICIQ bowel and Wexner score for fecal incontinence and the Cleveland constipation score for constipation. So presence of US symptoms in CRD patients were assessed, and the presence of bowel symptoms in UD patients were reported. And then secondly, absolute changes between test phase and baseline PROMs were measured as well. So these are our demographics. We included 50 patients in total. 33 were urology patients, 17 colorectal surgery patients. From the urology patients, 5 reported to have combined incontinence, and 4 patients from the CRD reported to have combined incontinence. Our mean age was 52 years and 78% were female. These are our first results. From the UD, 20 patients reported to have also bowel symptoms, so 61%. In the CRD, 9 or 53% also had concomitant urinary symptoms. And these are our main findings. As you can see in the UD patient, we see a significant improvement on all urinary associated questionnaires, but also on the bowel-related questionnaires, we see significant improvements after the first stage. Except from the Wexner score, there was almost a significant improvement. In the colorectal surgery department patient, we saw significant improvements on bowel-related PROMs, except from the Cleveland constipation score. But in contrast to the UD patient, we didn't see significant improvements on urinary associated questionnaires, except from the ICIQ urinary incontinence. But we do see some small improvements. If we look at the questionnaire scores itself, after the test phase, we see improvements on urinary associated questionnaires as well. So significant improvement in concomitant bowel symptoms in the UD patient can be expected after stage 1, but small improvement in urinary symptoms in the CRD patient can be seen, however, they were not significant. So this is an important finding for patient counseling. And in conclusion, the prevalence of bowel-related symptoms in patients referred to the UD is high, and as we already knew, SNM has a positive impact on both domains. This emphasizes the need for a holistic screening at baseline and during the test phase of all pelvic floor dysfunctions, irrespective from the medical department. Thank you for your attention.